Honourable Speaker, this government is considering hiring unit assistants to ensure reassessments of patients who are having to wait long hours in emergency waiting rooms. However, experts have said that this does not address the underlying problem. There's a bottleneck in ERs and urgent care centres because of a shortage of hospital beds and personal care home beds. What is this government doing to get to the root of the problem to ensure all Manitobans receive the necessary care that they need?
The Honourable Minister of Health, Seniors and Long-Term Care.
I thank the member for Tyndall for that really important question. And I want to thank the healthcare aides and UAs who have put their names forward to get additional training and provide really essential care in our emergency rooms. They're really making a difference on the front lines, and I want to thank those folks for skilling up and joining the teams. I would also add that for 7.5 years, 2 terms of a previous failed PC government, they cut hundreds, over 500 beds from across our hospitals in Manitoba. Shame. They closed, obviously, major emergency rooms, and they fired staff. They also caused a net loss of personal care home beds, over 200 lost in our healthcare system. We're adding beds back to the system. We're adding personal care homes, including building the personal care home in Lac du Bonnet, and I think there's a member opposite.
Member's time has expired. Order. The Honourable Member for Tyndall Park.
A 49-year-old man died on January 7th at HSC after waiting approximately 8 hours for care in the hospital's ER. According to media reports, this tragedy could have been avoided. However, the ER was over capacity, which is often the case for our hospitals. Honourable Speaker, the Health Minister stated on January 28th that there is a plan, but they have yet to share the plan publicly or with nurses. Will the Minister share the plan with us here today?
The Honourable Minister of Health, Seniors and Long-Term Care.
I thank the member for that really important question. And again, I would express my condolences to this gentleman's family and his community. Our government has taken a number of steps to address concerns, and we followed a number of recommendations that were brought forward as a result of the critical incident report and review that was done, including training UAs and healthcare aides to be skilled up and provide greater care in emergency rooms, including making sure that the public trustee can notify next of kin without barrier, including making sure that we have additional resources in those spaces. There's a number of additional steps as well. I'd be more than happy to meet with that member to provide that information beyond what I've said previously in this House.
The Honourable Member for Tyndall Park on a final supplementary question.
According to Shared Health's annual report, HSC now has fewer licensed beds in 2023 to 24 than it did in 2020 to 21. And bed occupancy has jumped from 83% to a dangerous 98%, leaving no beds for any patients. Honourable Speaker, these stats are under this NDP government. I would like to table Hansard from March 7, 2023, where the now Premier suggested a call for an independent investigation when a patient dies under similar circumstances. Will the Premier take his own suggestion and call for an independent investigation?
The Honourable Minister of Health, Seniors and Long-Term Care.
I just want to clarify some information for the member for Tyndall Park. So under the previous PC government, they cut hundreds of beds from the healthcare system, and they also refused to fund beds that remained. On this side of the House, what we've done is add more net new beds to the healthcare system, and we funded the beds that existed that were unfunded by the previous PC failed administration. So there's actually a net gain of almost 300 beds across the healthcare system, dozens of those beds at Health Sciences Centre. And we're doing the work of making sure that it's not just beds. It's much harder, 100%. Much easier rather to cut a bed than it is to add it, but we're adding beds 100%. And we're adding, most importantly, people at the bedside to provide care to Manitobans each and every day, and that work continues on behalf of all Manitobans.